apologize for this delay. We are actually got ready, but due to some technical error, we could not be able to make it. So we apologize for this delay, but nevertheless, welcome to our briefing.
Thank you again, members of the Fourth Estate. Just to repeat what Mutua has said, we do apologize, and karibuni to our briefing for the day. This is our 117th briefing. Good afternoon and welcome all. Fellow Kenyans, the coronavirus disease is now fully domiciled in our communities, as evidenced by the surging numbers which we have been reporting to you in the past few days. Like we told you yesterday, these figures will keep rising, something that should worry each and every one of us. And of particular concern is the rising numbers in Nairobi County. The capital city continues to lead with a number of infections, and as of yesterday, Nairobi had 5,705 cases, followed by Mombasa with 1,739, Busia coming in third with 550 cases, and Kiambu fourth with 520 cases. And in the last 3 days alone, Nairobi has registered 518 cases, and this indeed is a worrying trend, and something must be done. It is important that the residents of Nairobi are alert and are able to act very quickly in terms of adhering to the containment measures. It has also come to our attention that some Kenyans have resorted to stigmatizing those suspected, even those who have contracted COVID-19. And really today the aim of our press briefing is to highlight and to have a discussion on stigmatization when it comes to COVID-19. The behavior by some of our people in different ways, exemplified in different ways. We've seen people taking pictures, recording videos of ambulances and vehicles ferrying patients. We've received several social media forwards of people, depicting COVID-19 as a cause of different events in the community. And worse still, we've seen people even sharing pictures and videos of COVID-19 patients. And this has ended up leading to profiling of the infected people. And it's important that we note that this is highly unacceptable. We need to remember that coronavirus is a disease, and getting this disease is not a crime. And those who are infected with this disease are not criminals. And therefore, it is important we note that this virus can indeed be contracted by anyone. The high and mighty in society and everyone else in society, we've repeated over and over again, anyone can get this disease. And so it's important that we take care of each other and we avoid stigmatizing those who have the disease or those who may be affected by the disease. We'd also like to make a passionate appeal when it comes to the profiling of COVID-19 patients. We've seen different people discussing, symptoms of COVID-19 patients, areas in where they might have contracted, profiling them and elevating, stigma in the society. Again, this is something that does not add value to this fight of COVID-19 and ends up stigmatizing the situation and making it even harder for us to be able to maintain our containment measures, for us to be able to work together, adopting a whole of society approach in dealing with this disease. It's important to note, COVID-19 is a disease like any other. It's a disease like any other, and we really need to emphasize this. And it is important to note that stigma really will not go a long way in terms of combating this disease. It's important we continue to remember to maintain the containment measures, washing our hands with soap and water, maintaining physical distance, wearing a mask at all times in public spaces, and avoiding all forms of gathering. These indeed are the only weapons that we have against the disease at the moment, and once we follow them, we shall be able to remain safe and to be able to reduce transmission of this disease. With regards to our COVID-19 situation, today, 497 people have tested positive out of a sample of 4,922 samples tested within the last 24 hours. This brings our total caseload to 10,791. And so far, cumulatively, we've done 234 tests cumulatively. Of the positive cases, 480 are Kenyans, while 17 are foreigners. 318 are male, and 179 are female. The youngest is a 2-year-old child, while the oldest is 89. And in terms of distribution, like we've started today, again, Nairobi continues to lead with 292 cases. We have Kiambu with 62, Kajiado with 51, Machakos with 30, Mombasa with 28, Busia 10, Uasin Gishu 8, Nakuru 5, Makueni 3, Narok 2, Nyeri 2, Meru 2, while Kakamega, Kericho, Kilifi, Laikipia, and Nandi all have 1 case each. In terms of sub-county distribution, we've provided you the information out of all the counties that have positive cases today. And to highlight a few, in Nairobi, out of the 292 cases, 39 are from Westlands, whereas 35 are from Langata. Dagoretti North has 34 cases. In Kiambu, out of the cases mentioned, 13 are from Kiamba. Gatundu South has 9, Ruiru has 7. In terms of Kajiado, the cases highlighted, a highlight of that, Kajiado East has 29, Kajiado Central has 5, and in terms of Machakos County, we have Athi River having 29, and Machakos Town having 1. Whereas in Mombasa, Mvita has 14, Jomvu 9, Likoni 2. And in Busia, Teso North leads with a number of cases. In Makueni, it is Kibwezi West with the 3 cases there. We are delighted to inform you that today 71 people have been discharged from various hospitals, bringing the total number of recoveries to 3,017, and we thank our healthcare workers for this achievement. Regrettably, we have lost 5 more patients to the disease, bringing our total cumulative fatality to 202, and we send our heartfelt condolences to the family and friends of the bereaved. And again, we would like to reiterate that this disease does not discriminate in terms of color of your skin, status in society, membership, your affiliations in terms of religion, politics. Indeed, this disease can get each and every one of us wherever we are, meaning we are all at risk, and we can avoid it by keeping vigil, especially of our surroundings, adhering to the containment measures, washing our hands with running water, masking, ensuring that there's physical distancing. And that the only way to overcome it is if we observe these measures, and together we do believe we shall be able to overcome. Thank you. Questions, please.
Any questions? Graham?
Hi, Graham from The Standard. I would like to know what is the challenge that you get in handling critically ill patients? What are the regimens that you use? What is the survival rate? And what is your take on the increase in the number of critically ill patients?
Good evening. My name is Emmanuel Tov from KTN News. Just one question. The International Labour Organization listed COVID-19 as an occupational health hazard, and that those people who get COVID while at work should be compensated, or something should be done for them. Is the government buying this, and are those people, the medics who've contacted COVID-19, being compensated or given anything? Thank you.
Nancy Okware from KBC. Yesterday we recorded the highest number of fatalities, standing at 12, and out of those 3 were community-based fatalities. So my question is, are they people who are actually undergoing the home-based care protocol, or there are people who did not know that they had the coronavirus, and after succumbing to the virus they were tested and found out to have been positive? And my final question is on the home-based care protocol. So far, how many people have recovered? Thank you.
I'm Haemba from Ebro TV. My question is concerning the latest cases. Out of the 497 confirmed cases, does this include the 41 staff at the Pumwani Hospital? And then I understand the highest number so far we have actually tried to test is a maximum of about 4,000. Is there any plan? Maybe the government is trying to extend this figure maybe to around 10,000 in future?
Great. I think we can take that first round. Graham asked, what challenges do we face while handling critical ill patients? And in regard to this, one of the main issues is the critically ill patients of COVID-19. As we've mentioned time and time, most of them do have comorbid conditions. And so by the time they present to us, you're dealing with a patient who perhaps is diabetic, hypertensive, and that always brings about a conundrum when you're trying to manage such a patient. Additionally, the disease, if we can remember way back about 100 days ago, we thought that this disease was primarily a disease that affects the chest or the respiratory area of your body. New evidence is emerging from across the world that this disease is actually a systemic disease, a disease that has effects on your heart, a disease that has effects on your kidneys, a disease that has effects when it comes to the clotting of your blood and the coagulation of your blood. And so you can imagine in terms of critical ill patients, we're seeing a mixed picture, and the DG will emphasize more on this and elaborate on this. I'm familiar with patients who've presented with clotting issues. I'm familiar with patients who've presented with, managing their comorbid states as well as managing COVID-19. We are familiar with patients who seem to be presenting with inflammation of the heart. People who are not hypertensive, people who are not diabetic, people who don't have any other comorbid condition, but COVID seems to be affecting their heart, therefore making it even that much more difficult when it comes to managing a critically ill patient. What we can say, however, in terms of our different facilities across the country, particularly facilities that have perhaps now experienced more of the critically ill patients, I'm talking about Aga Khan, I'm talking about KU, KNH. These facilities right now do have one of, the most experienced health workers when it comes to managing a COVID critically ill patient. And the healthcare workers there continue to inform us that they are able to, do the best that they can, offering world-class care to the patients that we get. Of course, over the time we've emphasized that the ICU bed is critical, getting ventilation support is critical, but like raised by Graham, we are seeing other presentations beyond the need for that ventilatory support. And so as we go about the disease, as we try to manage this pandemic, and as new information becomes available, we'll continue to manage the patients as best as we can, and we are doing a good job of that. It's interesting to note, perhaps, and the DG will emphasize here, I'm aware of some good survival rates in some of our hospitals here in Nairobi, especially at the ICU level, where we've even had discharges home from ICU. So our healthcare workers are doing a good job. Emmanuel Tor asks a question on occupational health hazard. Are we recognizing this much like the way ILO has recognized it as an occupational health hazard? And what we're doing here is reviewing to see what that would mean in terms of the fiscal space, in terms of allocations for that. And there are teams looking to see, in terms of Kenya, workmanship hazards and compensations, what can be put in place to ensure that our healthcare workers are protected. What I'd request is once the teams finalize looking at this, we'd be able to then firmly communicate and confirm if this would be provision that's allowable for our healthcare workers here. In terms of Nancy Okwaro's question from KBC, community-based fatalities, the DG will give more information. However, what we do know, and as we've emphasized over and over again, home-based care becomes quite critical in our country at this point. And we've seen, success cases. We'll be able to share with you the numbers at that. But remember, this is, again, back to individual responsibility. It is about adhering to the criteria of who can be in home-based care and emphasizing that home-based care is not for the moderately ill patient. It is for the asymptomatic or mildly ill patient. And so we are confident that this program will continue to be of aid in the country. Kaimba asks, out of the 497 confirmed cases today, have we included the 41? I think, again, the DG will be able to emphasize this. I'm aware he actually addressed the media on this earlier today, so he will highlight on that. But Kaimba, in terms of the highest numbers ever tested, DG, I think we've gone beyond 4,000. We've been at 7,000, so we always keep tabs at this. So we are inching closer to that 10,000. Bona DG, you can add on.
Thank you, Madam CAS. Just to add on to question one regarding the critical ill patients, again, one of the challenges, of course, is the cost. On average, if you were to land in ICU for critical care, we spend close to 71,000 shillings or thereabouts to manage you on a daily basis. 65% of that is contributed to by the PPEs. But on top of that, of course, these are people who have comorbid conditions. and that makes the management more complicated because of the kind of presentations we get in COVID-19 cases. Some of these things which Waziri has alluded to, including the challenges that you'll face with the respiratory system, so you require ventilatory support. That being an invasive procedure puts you at risk of getting secondary bacterial infection in the respiratory tract, which of course complicates your management. Of course, also because of these underlying conditions, you find that these patients end up with multiple organ problems leading to what we call multiple organ failure. So when the lungs begin to fail, in sympathy the kidneys also slow down, the heart slows down, and you require to support all these organs. Of course, the kidneys, you require to do the hemodialysis to be able to remove the toxins. For the heart, you need to give them medicine for them to be able to maintain good blood pressure for circulation and perfusion to continue. All these are very complicated procedures and processes which take a lot of time of the healthcare workers, and therefore if the numbers surge, then you may not be able to have the adequate ratios of healthcare worker to patient to be able to offer that service. Notwithstanding the clotting problems that these people have, the cytokine storm, where your body in trying to fight the infection overdoes it and therefore puts the rest of the organs at risk. Now the beauty is that you are developing or generating data from our own homegrown cases, and we learn each and every day. So it's important that we do this capacity building, and we have daily webinars with colleagues from across the world in Africa, sharing experiences from US, Spain, China, Korea, and anywhere else. And I think going forward with all this information, if we can be able to bring it together, we'll only get better at managing COVID-19 cases. Our total cumulative cases of COVID-19 who have passed through the ICU is 199. Out of this, we have had 90 discharges and 73 deaths. As of today, there are 36 people in ICUs throughout the Republic. Out of these 36, 18 are on mechanical ventilatory support and 18 on oxygen. But the outlook is very good because now we have locally generated data. And of course, as doctors, the more you manage a condition, the more you get used to it. And therefore, you can be able to put in place interventions which will make a total difference. Nancy's question regarding the deaths, yes, these are community deaths, but these are community deaths not from home-based care clients. We told you that for home-based care, we are using a very judicious and cautious approach to ensure that those who go for home-based care actually qualify for home-based care and will undergo home-based care throughout the 14-day period. So these are cases of COVID which were diagnosed posthumously, that these people collapsed at home or died on arrival at the facility, and because of a high index of suspicion, then we go ahead to test for COVID, and then they turn out positive. Yesterday I think we had 84 people on home-based care. Of course, the data does not flow in on a daily basis because we have to get this data from all facilities. So the numbers that we disclose here will always lag behind the actual number of cases. But so far for home-based care, it has been good. Waziri last week we were within Kwale, and all the 4 people on home-based care are doing very well. Even the cases of Pumwani, the 41, 2 of them have been removed from home-based care from isolation totally. 39 are still on home-based care, but they are progressing very well. And I would like at that particular point to give you also statistics regarding the healthcare workers who have tested positive for COVID-19, who are 450. And one thing that could be working in our favor is, of course, our demographic profile. These are very young people. Out of these 450, 414 don't have any underlying problem. No wonder most of them are asymptomatic and they qualify for home-based care. Only 16 had hypertension, 6 of them had asthma, 3 people reported diabetes, 5 are HIV positive, 1 had hypothyroidism, 1 with cardiomyopathy, and 4 with other cases. So we are quite impressed with this, and we are hopeful that including the healthcare workers who are on home-based isolation, they are likely going to do very well. And all other patients that we select for home-based care, because of our young demographic profile, the outlook looks very good. It's not grim. I've addressed the question of Pumwani. Yes, the 41 are part of this. We are there today in the morning to look at on a fact-finding mission, but also to support the county team together with our county health director for health services at Nairobi Metropolitan Services, and to be able to see the interventions that we need to put in place to ensure that the healthcare workers are safe. And my final appeal to healthcare workers is, don't leave anything to chance. Please implement to the letter the information that you get from the case management team, from the infection prevention control team, so that you're not only safe for yourself, but safe to serve another Kenyan who may unfortunately come up with COVID-19. Thank you.